Welcome everyone. In this video, we are going to talk about what is the ASAM. ASAM stands for American Society of Addiction Medicine. But when people talk about the ASAM, they're not usually talking about the American Society of Addiction Medicine. They're talking about ASAM criteria. So ASAM criteria are for treating addictive, substance-related, and co-occurring disorders. It is a great big book. It's thick, it's heavy, it's expensive, and you can buy it on Amazon. So if you want to purchase an ASAM criteria book, you can always go to our website, pacificcrestclinical.com, click on our resources page, and click on our ASAM resources page. And there you will find all kinds of ASAM resources, including a link to Amazon to purchase the book. So let's talk a little bit more about what is inside of this book. If you are new to the addiction or substance use treatment field, then you may not be very familiar with the ASAM criteria. Or if you are coming toward client care from a more mental health perspective, then you might not really know what the ASAM criteria are. But this is what the book looks like up here, if you can see where my mouse is. It's a hardcover book. It is pretty long to read, and I would guess that most therapists have had a hard time reading it cover to cover. It can be a little tough to get through, but the information in there is really important to understand. So I've done the hard work for you, and I'm just going to tell you a little bit about what is in there so you can understand what it's used for. So in here, the content of the book is arranged to match a patient's journey from assessment through treatment and then to discharge and continuing care. So there's an introduction, and then chapter 1 talks about ASAM criteria and how it has changed over the years. Now, when I first started in substance use treatment, the ASAM criteria was a smaller book. It was not a hardback book. It was paperback. And it was a lot more limited, both in its content overall and in the detail of its explanation. So it has become more detailed, and for some therapists, it can feel like it's a little more complex to try to understand. Chapter 2 talks about how to apply the ASAM criteria in substance use care. Chapter 3 discusses intake and assessment. And then chapter 4 talks about matching multidimensional severity and level of function with type and intensity of service. So let's stop right there and talk a little bit about that, because there's a lot of big words there that might not make any sense to somebody who hasn't been using the ASAM criteria for a while. So basically, when somebody presents for their initial substance use assessment, the ASAM criteria provides you with tools for taking reported symptoms, categorizing them into 6 dimensions, and then placing them appropriately in the initial level of care. The ASAM also guides through that treatment process. After you've done that initial care placement, it talks about how to transition people through levels of care, whether you are increasing their level of care, perhaps their symptoms become more severe and you need to increase their care from maybe outpatient to residential services, or maybe they've completed intensive outpatient and some outpatient and they're doing really well, and so they are successfully discharged. The ASAM criteria guides you for knowing how to do that and when to do that based on the symptoms that somebody is or isn't demonstrating. So chapter 5 is service planning and placement. Chapter 6 talks specifically about addressing withdrawal management and intoxication management. Now, if you're familiar with the DSM-5, then you know there is a substance use disorder section in there. And so you would want to read that section of the DSM-5 if you want to understand how to then utilize the ASAM criteria for proper placement. The ASAM criteria does make references to the DSM-5, but it does not include that section of the DSM-5. So if you are going to work with a substance use population, there's a few things that you really need to have on your desk at all times. One of those things is an ASAM criteria book. One of those things is a DSM-5, and then also the NADOC Code of Ethics. Those are like your three basic things that you need to have access to right away when you are seeing a client with a substance use disorder. That being said, some clinics and treatment settings are very short on funds. And so sometimes in one clinical setting, they will share those items. But it's really important to have access to them, even if you're sharing, because you do need to check out what is inside these materials and have them ready to go at any time. Okay, chapter 6 is really helpful if you are concerned that you may not be evaluating withdrawal or intoxication properly in your clients. There's a lot of great information about signs and symptoms, both of withdrawal and intoxication. And if you pair that with the information in the wordier parts of the DSM-5, that will really help you start to learn how to properly assess for these issues. Chapter 7 is level of care placement, and that helps you know what level of care is appropriate given the diagnoses, given their withdrawal or intoxication status, and given the other symptoms that came out of their psychosocial assessment. Chapter 8 is application to adult special populations. So this would be considering people with certain medical issues, cognitive issues, or other societally related issues that we should consider. And then chapter 9 is emerging understandings of addiction. So trying to stay current on the new things we're learning about addiction every single day. Now, I will say that it has been a while since an ASAM came out. They do tend to get updated periodically. So I wouldn't be surprised if the ASAM criteria came out with a brand new book that we all have to purchase and read and learn. So if that's the case, don't worry, we will read it for you and create a nice long training so that you understand everything inside. So just one more important thing to note here, and this is on the very first page of the book. So it might be kind of important, and I'll read it. The ASAM criteria are designed to serve as a resource for general mental health and addiction treatment clinicians and counselors, but are not intended to substitute for their independent clinical judgment based on the particular facts and circumstances presented by individual patients. So this is really, really important because specifically in the addiction field, there is a tendency to become very concrete operational about a client's symptoms, what the ASAM criteria says about them, and then placing them in the appropriate placement. And so I love that this is on the very first page because it sets the tone. The ASAM criteria is not designed to be the end-all be-all of all of your clinical moves. It is a tool. It's a tool in your tool belt, but it's not the only tool that you have. So as a therapist, you may have somebody come in for an evaluation, and based on their symptoms, you have a certain outcome as far as ASAM placement goes. But in your clinical judgment, you may realize that they need something a little bit different. The ASAM recognizes that that is the case, and it's completely okay. But what you should do with that is make sure that you are consulting with your supervisor or trusted colleagues, and then also make sure that you are noting in your assessment and in your progress notes why you are placing the client differently than what the ASAM suggested. As long as it's clear to the next person picking up that client file, then you're good to go. So I hope that this gives you a little bit more information about the ASAM criteria. If you're looking for a complete training of the entire ASAM criteria book, we do have those periodically for you. They are 6-hour trainings. You can go to our website, www.pacificcrestclinical.com, and there will be a listing of the continuing education courses available. We also plan to post more informational videos on the ASAM to give you some tips and tricks for using the ASAM. If you are finding this helpful, please subscribe to our channel so that you can stay up to date on all the latest information, especially about the ASAM. Thank you.